Broadly speaking, one of the key goals of organizing this session is to collectively self-reflect on our equity and inclusion work and learn from each other's experiences to improve the impact of our equity work in the future. We are living through a special moment in history. A broader discussion is undergoing on the issues of racial equities and inequities. Brutal murder of George Floyd by police officers have jolted the nation and created an organic social movement around the notion of social justice and equity. In June 2020, a poll conducted by Ipsos, who are global market research and public opinion specialists, more than 70% of Americans described George Floyd's death as a murder. But as a nation, why do we have to wait for such severe and tragic incidents to pay attention to inequities that affects the lives of so many people around us? So these conversations are critical because historical and persistent patterns of systemic and institutional discrimination based on race, ethnicity, gender, ability, and other identities continue to undermine fairness of opportunity in our society. Therefore, at United Way, we are constantly and actively working against these inequities and injustices by challenging practices based on sexism, racism, and other historical and current forms of systemic discrimination. This includes addressing systems, policies, practices, belief systems, and attitudes that have often served to advantage some at the expense of others. So we are trying to lead the fight for equity and strive to create communities where everyone can have the access to resources, opportunities, and support they need to thrive. So to discuss this and more today, we will hear from our speakers who are leading the change in different United Ways across Pennsylvania with a shared commitment to create more inclusive communities and equitable outcomes for all. So I would like to bring in our panelists at this moment, and I would request you to share with us different diversity, equity, and inclusion initiatives that you are undertaking at your United Way. And in particular, if you can talk about your strategic goals of DEI and what was your implementation strategy to achieve your DEI goals would be great. So we can start with Adrienne. She has been active in the DEI space and growing the Coalition for Social Equity in Bloomsburg. So over to you, Adrienne.
Thank you so much, and thanks for inviting me. I think in our United Way, we are all about outcomes for sure, but I don't know that it's always the strategy that we're going for. I think especially our work within DEI has really been about bringing the community together and listening. So as soon as I started at United Way about 7+ years ago now, the Coalition for Social Equity had actually already been running for a long time in our community. And it was looking for a little bit of a different home. And it was very convenient actually for United Way to pick up the work because I was able to do some of the work of the Coalition for Social Equity, which is an all volunteer group of people as part of United Way work, which is a huge advantage actually for volunteers to have someone who can do some of the work during the day. And it's not all work that, maybe they have to do then at night or, on the weekends in their spare time. So pretty early on, the Coalition for Social Equity is a group that's really trying to just celebrate difference in the community. And then also we've done a lot of work with mediation and making sure that, if there are differences that come up, it's meant to be a really neutral place where people can come and say, something has happened in the community and have it maybe be mediated out. And actually, because of the work now in Bloomsburg, Pennsylvania, the town was able to pass an anti-discrimination ordinance, which really came from the work of the Coalition for Social Equity approaching the town and saying, this is not always a safe place, unfortunately, and there's nowhere to take complaints once something does happen in the community. And we have had things come up over the years. So we were able to work with the town, and now there's a Human Relations Commission that's being trained now as mediators and an actual hub for, for things to happen. And we do say that Bloomsburg is a place where we don't, allow discrimination to happen because we have this ordinance. So we're really proud of it. But through the work of an all-volunteer group of people, we, of course, in educating the community and, in holding one-off events, we've learned a lot along the way. So I think that was always a really great starting place. But in the last year, we've actually been able to pay an equity consultant to come alongside the United Way and help us do internal work to make sure that we're a little bit more ready for the work of, especially equity in our community. I also, as you said in the beginning, in the last year have taken over Greater Susquehanna Valley's United Way. I was at Columbia Montour for a long time, and Greater Susquehanna Valley has also had a Diversity and Inclusion Impact Council for 10 or 12 years and has been, I think, doing a lot of similar work where they're, creating a convening space for people who are interested in the work and want to learn more. I think now we're moving into splitting out a little bit the people who are interested in the work and the people who have skill in the work, or the people who do diversity, equity, inclusion work within their work or have gotten, maybe advanced degrees in it, because we're learning that great intention is good, but you can make a lot of mistakes in great intention. So the equity consultant and some of this other work has really been an effort to make sure that we are always doing the work with a best practice and not just a good intention. So we are in the process of hiring an equity strategist, a full-time person to work in the 5 counties. And our next steps in this very much process journey, is going to be to map the community to better understand who is already doing the work. And it's, I think a lot of times with the United Way, we say we're convening meetings, to bring everybody under one umbrella. I don't know that the purpose here is to bring everybody under one umbrella, because some groups are really interested in doing education in the community. Some groups are really interested in creating or going to rallies or speaking out, doing advocacy work. A lot of groups have different purposes, but what we want is when community members come to us and say we're interested in these different things, to be able to send them out, to their area of interest. But we really want to make sure we know what is happening in the community so that we can be, putting people to best use and where their interests really are. And then we really want to be identifying the things that we want to see change in the community and be putting the right people to the work. So the idea before was to hire one full-time person who is going to be doing that. That's not really possible. So what we're looking at now is doing some community mapping. We've got some money fundraised, and then being able to say on each different project, who's the best person to be doing this and which group should be doing it, and how do we empower local groups that are already doing the work to be doing the work, not necessarily doing it under United Way's umbrella. So I think that's good for now. Kevin, maybe I can turn it over to you to share what's going on in your neck of the woods.
Yeah, I mean, I can hop in unless Isa, does it matter where Michael or I go next there?
It's okay.
Sorry, there.
I didn't know if you had any different questions for us, but so trying to think about this in the most succinct way. So my undergraduate studies were justice, peace, and conflict studies at Eastern Mennonite University, and also theater. And my theater degree was essentially a theater and justice. So from a faith-based perspective, as a Mennonite pacifist, like this is part of my faith core. And then as an individual academically, it became part of my academic work. Did a semester in the Middle East, in Palestine, Israel, have traveled in Nicaragua and done some time there with Witness for Peace. And just a lot of my life has been trying to figure out how we wrestle with this sense of inequity in various forms and ways, not always using those phrases or terms. When I graduated college, I actually went to Pachabene Nonviolence Service. I did a year of voluntary service there. And then I did an AmeriCorps year here in Lancaster, so Pachabene, we taught nonviolence. And in the way that Adrian's talking about, it had to have different vectors. So education, action, awareness, and communication. And so wrestling these sort of large meta issues into manageable streams is often difficult. In Lancaster here, Community First Fund does microloans and for small businesses and for historically disenfranchised individuals. Before here I ran Meals on Wheels, which is thinking about seniors. So when I got here, what I brought was just an awareness that these conversations are often reactionary, So a lot of people talk about George Floyd. I remember when someone said to me the next day, they said, "Oh my goodness, Kevin, as a Black man, this must be so difficult for you." And I said, "I'm sorry, what?" They said, "Well, you know, this George Floyd murder thing." And I said, "Nothing's different today than was yesterday or the day before. What you see as an awakening in George Floyd happened for me with Trayvon Martin, happened for me again with Michael Brown and Ferguson. I don't know where you were then. I don't know why this time is different for you. But tell me when legislation changes. Tell me when individuals are held accountable." And so part of that me saying that is I have actively had to learn, and my wife working in disability services was so helpful for me. I've had to learn about other groups. Working at Meals on Wheels taught me about seniors. My wife working in an occupational development center taught me about people living with disabilities. Serving on a variety of community boards have taught me about other groups. So what I hope, what we do here, the project, to answer your question directly, the project that we're really starting to work with Isa. Isa is our first director of equity. So we created, similar to Adrian, we said we need to make sure that we're good internally before we start having expectations externally. And so when we did that, as a person who presently serves on 8 different boards, in which I think is a variety of board members who are equipped to be board members. And that's just on the function of governance, function of policy. And so when I looked around those rooms that didn't always have fully prepared members, and then you realize that those rooms are exclusively white, almost universally. So I came to United Way and I said, what would be great is if United Way could provide resources for organizations to diversify their boards. And I was told, "Oh, we used to do that." So we used to do that. Well, in 2015, when we made our shift to collective impact, we had to pare down our priorities. That was simply one that went away. Not for any particular reason other than capacity. And here we are today with this conversation. I said, let's look at that. So we revisited it, but here's the important part of what Adrian covered this too, is the change that occurs in the work that you do is not going to be perfect and can also cause harm, but that also can't be a refusal to do the work. So you're going to make mistakes, you're going to have missteps, but limiting those is important. So when we look back at our previous program, excellent program. Wide range of just success from people who were graduates in our community doing great things. The CEO of CAP, Vanessa Filbert, both used to help run it when she was an employee of United Way and also as a graduate. Kate Zimmerman is a graduate of it. She runs Leadership Lancaster. She's white, right? So it wasn't all Black and brown individuals, but it was largely Black and brown individuals. Norman Bristol Cologne, who works in the governor's office, Derek Birch, who's over at the Mix. So we saw all these individuals who ended up in these spaces. But we also recognized that those spaces that we sent people to haven't always been inclusive. So we said, let's bring back that program, 1. Let's evaluate the program, 2. So we're saying, now we're going to make sure that we have other groups who are underrepresented. I had a conversation yesterday with a high school friend who called me because she had to spend 90 days in prison because she drove on a suspended license and all of these snowball effects. And she said, "Kevin, you'll never believe what goes on in there. You'll never believe how people are trapped and they can't get out." And I said, you know what? You're on my short list because I'm looking for individuals returning from incarceration who we can put through board training so that they can go sit on those community councils, on those advisory boards for authorities and government, and expanding what we understand as equity is not just racial equity, it is equity broadly. So improving the tools that we've already been doing. I, for years, used to teach anti-racism analysis trainings, and I stopped a couple of years ago because I realized I was doing harm, not in my training, but because for many people I was a checkbox, so they no longer had to do anything more. These trainings have to be holistic and they have to be systemic. And so that's the work that we're here going to be really engaging in. Michael?
You guys got Kevin on a fired up day. Congratulations, everyone. To add into that, you'll hear me speaking a lot of sound bites because I think most of you that are here today, you're here because you want to glean an activity or something that you can do, a change that you can that you can make within the DNA of your organization. So I will start with challenge the status quo. Whatever that is in your organization, in your family, in your Faith-based community in your social group, challenge the status quo. We see ourselves as change agents because we are constantly identifying the pressing needs of our community, and we see our community as an ecosystem where intersectionality cannot be ignored. If one thing you do today, look up what intersectionality is and how that Venn diagram of the different circles layering over in your community have impact. If you say poverty is our focus, poverty is a major issue and a challenge where you are at. But if you see poverty and discrimination overlaying each other, it's going to be multiple times as hard. If you see poverty, discrimination, and trauma overlaid, it's going to be compounded. And as Kevin just mentioned, the aspects of social identity are very broad. It can be everything from gender, sexual orientation, race, disability, mental health, appearance. There's 27 different terms that I can throw out about one's social identity, and how they show up will also be how do we talk about marginalization within a community.
Thank you, everyone. Michael, I know that Pocono, United Way of Pocono Mountains have launched some very successful initiatives around book drives, vaccine outreach, and programs for first-generation students in the rural counties. Can you please talk about that, and how did you engage these first generation of students, and what was the response, and is there any significant youth engagement strategy that could come out of it?
Yeah, that's a great question. And I think, again, a point to make is that DEI work is not separate and distinct work of our United Way. And if you are serious about doing DEI work, it needs to be embedded in every aspect of our organizations. That is from board and staff composition, that is to policies and procedures. Your employee handbook should be reviewed with a lens of DEI. Program development should be also considered in that same way, where programs are designed with a level of cultural sensitivity, that they are implemented with cultural humility, and they are evaluated with cultural competency. And the initiatives that we've taken on, as you mentioned, the book drive was because we believe that students and children should see authorship and illustration that resembles them and their community. We believe that our vaccine outreach, which we actually have one of our past employees on the call today, I saw him show up earlier. We launched a vaccine outreach program in September of last year, because we saw that there were underrepresented groups within our community receiving information about COVID-19 and the different mitigation strategies. And we saw an amazing change take place. Over 7% of our community became fully vaccinated between September and February. That represents almost 12,000 people in our community, which is incredible. But what I think is really interesting to see is that we now have more persons of color fully vaccinated in our community than our non-brown white community members, because we were intentional about getting information out to populations and communities that were not receiving the information about free vaccinations, free testing clinics, masking programs, all of that. In this vaccine outreach team delivered trusted information, and they train trusted advisors so that the information can get out equitably within our community.
Great, thank you. And since we are talking about vaccine outreach program, I would also like to mention that United Way of Lancaster County was also a recipient of grant through Temple University that focused entirely on equitable distribution on information about COVID-19 vaccines. And last year, from August through November, our community health team launched a public health campaign, which involved door-to-door campaign, equipping local social service agencies with information and access to vaccine, and partnerships with healthcare workers or vaccine clinics, and then radio and news broadcast. And we were working with other two organizations and who continuously and actively engage marginalized communities with vaccine information. And their names were Patients Are Waiting and Community Care. And the goal was that we just wanted to ensure that our community stay healthy, and the marginalized community who do not otherwise have access to the right information about COVID-19 vaccine, they should get access to that information and also get vaccinated. So it was something I'd like to add to.
Isa, if I can add to that, part of the reason that was necessary is that when the individuals in our community who were setting up locations for vaccinations, they made their large vaccination clinic, which had thousands, tens of thousands of people go through. Excellent, right? Excellent. But they put it at the mall where there's no walkability to that location. It's not easy to get there by public transportation because the public transportation system isn't sufficient in this community. If you're in the southern end, the bottom third of this county basically doesn't have any access to public transportation. And while they said, sure, we'll send out the Red Rose Transit vans to get you, it takes 30 minutes to get down there. You're on a van that's going to have to pick up 5-10 other people, get 30 minutes back. You're talking about a half a day to get there. When they set up the testing site, they put it at the emergency management location, training center. Makes sense. They don't have to pay for rent and other things. They own that space. There's no public transportation there. There's private vehicular access. So when we set up our public health responses in a way that doesn't think about flipping the paradigm upside down in who we normally think of the conversations that we have. We now have a health advisory council. It's not a public health department, adamantly not. We don't have one in Lancaster. And it's not of interest to our community leaders. But they set up a health advisory council, which is what their mechanism is for success. And hopefully I wish them well, and I hope that it is successful. But it's very curious and concerning when they talk about adding all of the major healthcare systems to that health advisory council, but they leave out Union Community Care, who is the federally qualified health center that manages both Lancaster County and Lebanon County, thus showing not only Lancaster expertise for marginalized, underrepresented community members, but also a regional understanding of what's going on. And the CEO of that organization is the only individual who would have served on that council had she applied and wasn't put on. She actually worked for the Maryland Public Health Department. She has a master's in public health. She could help with this issue, both from the equitability and from the public health expertise. When we don't prioritize the poor and the marginalized, then we can't be surprised when they continue to be poor and marginalized. The system is working exactly as it's designed to do. It has never been designed to be fair. And it has never been designed to prioritize those who were not already white landowning males in 1798, right? The system has slowly been modifying, but we have to remember where it began and where it's going. And as Michael said, challenge the status quo, because the status quo in our nation today has been and continues to be designed against the individuals in the ALICE population, and not just Black and brown individuals. The poor, you're white and poor, the system is designed against you too. And it is our responsibility, moral, I will throw in moral as a pastor, moral, but also just as a human being, to make sure that our comfort doesn't come at the expense of someone's existence.
Preach.
Well, I'm preaching on Sunday.
I hear you.
Legs if you want to. So, I'm getting ready. I got to get ready.
I talk about challenging the status quo, and sometimes people don't know what that fully means. So let me just break it down real quick, I guess. Challenging the status quo first means you get curious. Start asking questions. Ask questions, and questions are great. As Kevin said, sometimes we have to put the lens on ourselves and say, are we doing the right thing first? Are we doing internal auditing of our personnel policies, of our staffing, of our governance structure, of our funding models, of our outreach efforts? Who do we partner with as vendors? And it can be as simple as, when you're doing a staff luncheon, where do you order from? And I think food is the most basic. So please, don't think that my words of encouragement is just try to be, broadening your palate. But we ask ourselves, who do we partner with for our marketing? Who's our printing companies? All those kind of things. But challenge the status quo very simply is, one, you get curious. Two, you empower. You empower yourself, you empower others, you use your position to elevate the platform of others that don't have the microphone. And then third, very simply, is you do something. Do something. You ask questions to gain knowledge. You empower to share that people do have voice, and then you do something about it. And it's that simple. It does not need to be an organized project that takes a year. Today, you can challenge the status quo.
And I think that probably some of you are thinking, well, some of the people talking today are in bigger cities and we just don't have the population here for that. But we actually last month just did a really great presentation on our census data and how even if 1% of our population is Asian American, that's still thousands of people in our community of, 67,000. So I think that we need to be really careful about who we're erasing by saying, oh, my population is only 1% or 3%, or, because I know that that's a lot of counties in Pennsylvania. So I think that, just as everyone has said here today, just getting curious and thinking about things a little bit differently, which for us is where really having someone who was trained to do DEI work and not just well-intentioned and interested, or, I have a degree in anthropology, that does not make me a DEI expert. That makes me a little bit curious to go and find people who have the good information to bring back to my organization. So, even if you have a community where, there are smaller populations of people of diverse backgrounds, this work is still important and it's still really relevant, maybe even more so.
Yes, thank you. And that's right. And it really bridged to my next question. And if you can expand more on how diversity, equity, and inclusion principles inform your community engagement. Adrian, you talk about engaging volunteers in that coalition. So how do you attract volunteers, and what parameters you consider when making these engagements based on equity and inclusion lens?
Yeah, I think I might do a really good job of somewhat sidestepping your question, but answering it in my own way. And actually what we have come to and what we've been talking about a lot in the last couple of days is, as we're building out our volunteers around this area, really starting to create around DEI a core united way internal group of people who are able to set the structure of what we want to do and who we want to invite to the table, having a secondary core of people who are interested in the work but are also doing the work in the community, and having that really be the group of people that's setting the stage for what we are doing in the community. And then having a bigger group of people, and that's our kind of our large group, who come to all of our events, who maybe come to our monthly meetings, who are really interested in learning more and maybe are an expert in one of those areas, but aren't looking at the work as holistically, maybe do it, as a secondary to their full-time job. So I think what we're really looking at is, before it was anybody interested, come to the meeting. And that's how we sometimes end up having good information, but not great information, and doing things like a really great half-day retreat, but where we accidentally make a little bit of a mistake, where if we had brought the people who are really doing the work to the table to help in our planning, it could have just been tweaked just a little bit. We're not talking about big things, but just a little bit to make sure that we were completely on course. We have also, in all of our marketing, our diversity consultant is also now checking our marketing to make sure that we, in our Black History Month marketing, little tweaks to make sure that we weren't accidentally making those really, really, what to some people might be obvious, but is not obvious to me or my marketing person, mistakes, so that we're really putting out the best information. And I think, again, this is not exactly what you asked, but, if there's one thing that you could start doing today, I really do think that it's self-education and truly getting your staff the education that they need to be able to start doing this work. We're finding that our staff do not have the tools that they need right now. So our DEI consultant actually was really meant to be a DEI consultant to our partner agencies, where they would help them develop their board, develop their staff, develop some additional policies. And the person, after a couple of weeks, came to me and said, the first work is with your staff. It's not with the partner agencies, because you do not have a readiness to do this work. And it was a little tough to hear, because I thought we were in a different place, but that's okay. So we're doing the work internally first. And I think that has really got to be the starting place, because, you know, we know through the push from United Way Worldwide, we know our boards aren't ready. So let's make sure our staff are ready, and then we'll move it out to our boards, and then we'll move it out to the community. But let's make sure that we're doing the right work first, because for us, that has been, you know, the starting place.
Great, thank you. And I agree. And as Kevin mentioned, that is what we are trying to do here at United Way of Pennsylvania. We wanted to make sure that as an organization, within organization, we should align our priorities as per the equity lens, and we are ready to do this work, because then when we go into the community and take on the initiatives and involve in community engagement, we know that we have a specific direction and path, and we know what we are doing internally as an organization is right. Kevin,
go ahead.
Yeah, would you also like to add in about how our equity and inclusion principles inform our community engagement efforts, and how do we take these efforts when?
Yeah, we're going to be putting out some new grant money soon, and one of the things that we're going to make sure is that, you know, there's some level of equity lens to those, but that doesn't mean that you're perfect and you're ready to be at the end of that journey. Being on the journey itself is part of the success. Like, I want to be clear about this. The worst thing you can do is assume that you're going to solve these issues in your generation. These are hundreds, thousands of years, depending on which way you're looking at this. But in the United States, in the conversation between Black and brown and white, this is hundreds of years of established base how we exist. And this goes to Kelly, to your question a little bit, right? You really can't be too afraid of not getting it right, but you can be intentional as you pursue trying to do better, right? And so listening, asking those communities, sometimes those communities don't want to be a part of it. It's tiring to constantly have to fight for your own existence to exist, right? Like, so, you know what? Have a rally. I don't want to be in charge of it. Well, that doesn't mean that you shouldn't have a rally, because I, from that community that's impacted, said I don't want to lead it, right? So it is a challenge to figure that out. Here at United Way of Lancaster, here's a small thing that I did. And Isa can speak to it as well. But it was, you know, Christmas holiday and then New Year's. And I thought, you know, Isa, my colleague here, who just joined us since the last holiday break, is Muslim. I'm giving her off for Christmas. Now, without thinking about how do we sort of, sometimes these things become, well, we're going to have a no religious, or we're going to have a you know, really sort of tokenizing effort. And I said, you know what? We're going to add a day. So we added a day, and we said, some of you are religious, some of you aren't. I don't know the holidays or the celebrations that you prioritize. You choose how you'll take that off. And in my email, I did mention one example is that you may not celebrate Christmas, but you may celebrate Eid al-Fitr, which you may have heard of Ramadan. Well, Eid al-Fitr is a particular moment within Ramadan that's a celebratory moment. I know that because one year I went with my Pakistani friend and I celebrated Ramadan. I went through the whole process of fasting, and he taught me, and his family taught me so much that I had learned that moment. And when Isa thanked me for mentioning this email, she specifically thanked me for recognizing that acute moment within the broader celebration, right? So the point here is that I learned from experiencing someone else's culture, and then I applied that very small thing. And an individual in my organization felt seen and heard. Others who aren't religious acknowledged an appreciation for them to be able to use that time. So how are we making small adjustments to our policies that really say, all right, I just want you to know I see you. I just need you to know I see you. I don't know if everything's right, if everything's wrong, but I see you. And what that does, I hope, is that when we get to a point, and so the next staff meeting, Isa shared with the whole staff about both that sort of experience and then about that holiday. So now everyone in our organization has at least some level of basic understanding. Well, the next time that we have a tragedy in this community and we have community members getting all xenophobic, like happens, you know what? This organization now has someone, everyone can say, I know that person. And the vilifying of a whole group of people or culture that you're doing doesn't work on me anymore. So being able to just know each other, interact with each other, and throw one another some type of opportunity to be seen, I think goes a really long way. And just as a practical, I encourage, a couple of us have talked about identifying issues within your own organizations, whether you have an outside consultant or whether like Isa and I are doing that work internally for our organization. I just encourage you from this conversation, whether you're in a leadership position or you can ask your leadership, make one change to a policy or a practice, even if it's small. It'll yield results down the line.
That first step, make it a step right today. And what Kevin's also describing right there is inclusive environment. Trauma shows up. Trauma shows up in the body. There's a book that I'm reading right now called My Grandmother's Hands, and it talks a lot about how trauma shows up in the body. Racialized trauma shows up. Generational trauma shows up in the body. And you know this. Every person in here has walked into a room and they either feel safe or they don't. They either feel like they are comfortable in that space or they are not. You can go into a family gathering in the same way. If you have tension in your family, you're a little bit prickly. You're on edge. You're watching what you say. You watch what other people say. You watch their body movements. In the same way, work environment should not be that. Community environment should not be that. And that's something that we as leaders need to create. We need to create environments where every person feels they belong. And somebody asked me, where does addressing the issues of racism, discrimination show up? And I said it's 3 spots. First, individually. And as Adrian said, you learn on your own. You read more, you lean in, and you ask those questions. Then you start learning interpersonally. You actually start being in community with people with different social identities than you. And as Kevin mentioned, you ask questions, you learn, you listen. And what's really important about that is that if there is something going on that affects a different marginalized population than you identify with, and it does not have a pain in your heart, I'll be the one to break it to you. You are not actually friends with that person. You know a person that is being affected, but you are not feeling the deep-seated pain that they are feeling. And then the last point is institutional. So you go from individual to interpersonal to institutional. If you have power, privilege to make changes happen, and you don't, that's on you. You have to be okay with that. You have to recognize that. And here's that, going back to challenging the status quo. By simply being in this room, I'm going to encourage you and empower you to say you have that, to make the small change possible within your organization today. Any person in this room can raise their hand and say, I would like us to question this. I would like to bring this to higher leadership's attention, because it is not a marginalized person's responsibility to raise their hand and raise questions. Every person in this room has the ability to voice a concern that they see. And that's an examination that you do. Examine the dynamics and the composition of your kid's soccer team. Where do you frequent? Are you surrounding yourself? Are you, interjecting yourself into conversations that can create change? And it's not just these big global change items. Start small. Read a book that you've never read. Read a book. I mentioned My Grandmother's Hands. It's a great book that you can pick up. If you want a list of resources, we have them listed on our website that will help you educate yourself on the topics of DEI. But get curious.
Thank you, Michael. And yes, you're right. Starting with small steps and making a change individual level, then interpersonal and organizational level. And also going back to Kevin's point when he said that United Way of Lancaster County added a day, I would like to mention that this day is not a replacement. This is not an adjustment for a different one in the calendar year. But I honestly felt that this particular day was to recognize and honor me as an individual being part of that organization, me as an individual who was different from who my values are slightly different and culture from what is celebrated by most of the people in this organization in the country. So I truly feel that this gesture and adding this day in this calendar and holiday meant a lot. And again, these small changes makes a difference. So, and they make your employees feel included and honored. So thank you. And moving on, I would also like to talk about what are the challenges that you faced or any setbacks that you faced when you started this work, when you do the DEI work within the organization and your communities. Because I guess talking about that would also help anyone who is new to the work and how they can navigate from some of the challenges they might face in this journey. So Adrienne, would you like to start and comment?
Sure. I think that some of the challenge that we have faced is just getting a handle on what level everybody's at. And, as a small example, the United Way of PA equity series, Michael, not remembering what it was called.
Cultural humility.
Yeah, was awesome, and I really enjoyed it. It was a little advanced for my staff, and it actually caused a little bit of a misstep in the organization. And so luckily the equity consultant who we have also went through the training and was able to break it down a little bit further. So I think that those are some of our missteps with the community too. Gauging where the readiness has been challenging. I think I'll leave it there.
There are costs, and expect costs, and be prepared to have costs. But remember that the people who you're working for have institutional barriers which are much more significant than the costs that you're likely to face. I enter this job every day, knowing that there are things that I do that do not make community members happy, including donors, including legislative representatives, including staff members, and that it is possible that my board members aren't always happy. I may lose my job because I prioritize this work. If this work matters to you enough, you would rather not work at a place that doesn't want to take this work seriously. An institution that is that level of reticent to change and to actually authentically, not just performatively, making a difference in how it operates and how it impacts the community, that's not a place you want to be. They do you a favor if they take your job from you, and a job is just a job. That's so also easy to say and hard to say. But you may lose staff members. We've had some turnover here, and you don't always get the reason why. I don't know. It's quite possible that when we brought the YWCA in to do their racial analysis training and we lost a staff member relatively shortly thereafter, it may be because of that. But if it is the work of your institution, fit matters too. And so you just have to recognize that there are going to be costs. You have to be okay with them. And you have to figure out how much okay you are with them and how much your organization is okay with them. Fortunately, I'm in a great spot where my board is absolutely gung-ho about this. And what I hear from staff is they are absolutely gung-ho about this work. They may not all be true. There may be gradations. I don't know. But I've been in other organizations before, that particularly corporate organizations, that would not be interested in the way in which we're trying to redo, rethink, and re-envision the world. And so I'm not there, I'm here.
Thank you, Kevin. Michael, do you have anything to add on the challenges and what people should expect when they start this journey, and about setbacks they'll probably face?
Yeah. 2 weeks ago, I led a conversation with other DEI practitioners around the concept of racial equity, resiliency, and apologetics. we should anticipate challenge. We should anticipate barriers and bumps in the road. And the more we can center ourselves around other people that are doing good, there's resiliency because it is now meaningful. It has an impact on the communities that we serve. If we don't show up today, it has an impact on someone. And that is not to describe a savior complex. That is to recognize that while we are in our jobs, every person that's in this room right now has a responsibility to care for our community. And there's no mailing it in for this work. When you are in human services, people are dependent on us. They need us to provide the resources, but that is not us helping anyone. We have the privilege of coming alongside people that are trying to better themselves. And what we are doing is removing barriers. It is not to go in and save a community or a person group. It is to remove the barriers. And I think, as Adrian mentioned, sometimes we confuse language. And I think that's where shared language is really important. We've often talked about white privilege and cultural humility trainings, and people don't understand what that means. And so a quick definition that I would share is that white privilege is not a description of financial or income or wealth. It is simply the absence of a barrier because of the color of skin. And that is not to say that non-brown white individuals do not have challenges. They certainly do. But the color of their skin is not a contributing factor to those challenges. And that simple understanding will help organizations move forward. And I saw in the chat, a team member of mine, Masozi Houston, pointed out so much of the beginning stages of DEI work is listening. So again, encouragement. I know people want to do always, but sometimes it is listen, and as I said, listen, lament, and lean in. That's how we start off, but anticipate you're going to have tough moments. And that's why you have folks that are in this room that are here to say, we are with you. We will encourage you. We will tell you how we handled it correctly and sometimes incorrectly.
Thank you. We just have a couple of minutes left, and if anyone on the audience can have any questions, please feel free to drop in the chat, or any comments that you would like to share with us.
We have a staff-led DEI committee internally, and we've been pretty careful about who we choose to put on that group.
And I'll be honest, we've struggled to start that. And I think some of that comes from, I'm a person who has a lot of experience in this, and I'm curious, I haven't explored this too much, but I'm curious if part of the challenge is me being on that committee intimidates other individuals, that they don't feel as advanced or experienced. And so as I rethink this, some of those staff members have moved on. As I rethink this, part of this is making sure that space doesn't only feel safe. No one's going to feel unsafe with me saying that they're for racial equity, right? But the different kind of safety, which is just feeling like I am enough. And it's hard, no matter how much you say it, it's hard sometimes for people to hear you're enough, and where you're at is where you're supposed to be, because you're at the starting line or you're in the middle of the race, wherever. But today you are where you are supposed to be because of everything that happened before. But you dictate where you go forward. But sometimes having those rooms be significantly imbalanced between those who have done work and been experienced and those who want to but haven't felt like they've begun can be a challenge. And so thinking about that balance is also really important.
We also, I have asked all of my staff members to commit an hour a week to DEI work during the workday. So that's become an expectation. And one way that we're doing that is with an equity hour, where our equity consultant is bringing a topic or something that has happened with, a staff member, but for an hour, the staff are welcome to come and talk. And I think if you did something like that, that could lead to a staff-led DEI committee once there's some common language and, some understanding. So that could also be a really great place to start with people who maybe don't have, the skill or need to be building their skill.
I think that's a great example, because providing people with the tools and knowledge would be a first step, so that they feel equipped and they feel knowledgeable to actually get into this work and get involved into this work. Any other questions? Okay, we're in the last 4 minutes. Do you have any final words to say on your work, or any recommendations you would like to give to our audiences who are in this journey and starting this journey?
I just typed in the chat, making sure that you're actually compensating individuals who are leading this work. Your budget shows your priorities. If you're not willing to pay an individual to lead that work, whether it's like you, Isa, leading a whole department in full time, or even if you're saying, can you be the person who caretakes this 1 hour a week? Are you paying that individual for that? Or are you removing other work from that, particularly when you're asking individuals of color? I've had a lot of individuals in this community of color who say, I don't know anything about this work, but I'm the only brown person in my organization, and they came to me and asked me to be in charge of this. And I don't know what to do, and it's not something I'm passionate about. So be careful in regards to that. And Dory, to your question about boards, that's the work that we're going to be trying to do here at United Way of Lancaster with regards to our project blueprint. The boards are too often social nepotism, and then what ends up happening is you don't have diversity. Diversity brings excellence because it brings different perspectives, and that should happen at the staff level, and that should happen at the board level. Boards that do not diversify themselves will fall behind in excellence because they lack diversity of thought, which lacks the ability to see new pathways and new opportunities.
I appreciate Joshua's comment in the chat as well about self-care. As Kevin said, the impacts of systemic racism have been built for 400 plus years. We are not going to eradicate in a 1 hour panel discussion or an 8 hour training or a career. But to recognize that this is long work. This is hard work, it's hard work. And that's why it's also important to center around other practitioners for that type of care in doing this work. I think that's something that I would encourage people to leave with. And Valerie, I'm going to put my information in the chat. I'd love to connect more about some of the other industries and how we've just really used different statistics to tell a story. Stats are great because they show you big picture, but they don't have emotion. And so, a statistic is only as good as the story that we tell behind it. And we've been able to do some incredible work, even just with our Chamber of Commerce, of educating folks in our community. And when they said, like, is this really true, or is this your opinion? We brought information from Harvard, from the Federal Reserve to talk about disparities. And they were shocked. And one of the guys, he was seeking information to possibly discredit, and ended up talking himself into understanding.
Thank you so much. And I think that was a great discussion. 1 hour is never enough for these discussions, but thank you so much, Adrian, Michael, and Kevin, for your conversation, for the conversation we had. And I hope our audience enjoyed it too. We are having some really interesting conversation going on in the chat right now.